the hearing will come to order. As this hearing is fully virtual, we must address a few housekeeping matters. For today's meeting, the chair or staff designated by the chair may mute participants' microphones when they are not under recognition for the purposes of eliminating inadvertent background noise. Members are responsible for muting and unmuting themselves. If I notice that you have not unmuted yourself, I will ask you if you would like the staff to unmute you. If you indicate approval by nodding, staff will unmute your microphone. I remind all members and Mr. Secretary that the 5-minute clock still applies. If there is a technology issue, we will move to the next member until the issue is resolved, and you will retain the balance of your time. You will notice a clock on your screen that will show how much time is remaining. At 1 minute remaining, the clock will turn yellow. At 30 seconds remaining, I will gently tap the gavel to remind members that their time is almost expired. When your time has expired, the clock will turn red, and I will begin to recognize the next member. In terms of the speaking order, we will begin with the chair and ranking member, then members present at the time the hearing is called to order will be recognized in order of seniority, and finally, members not present at the time the hearing is called to order. Finally, House rules require me to remind you that we have set up an email address to which members can send anything they wish to submit in writing at any of our hearings or markups. That email address has been provided in advance to your staff. And with that, I would like to acknowledge the ranking member of the subcommittee, Congressman Tom Cole, and all the members of the subcommittee on both sides of the aisle who are joining today's hearing. And I would like to congratulate and welcome former colleague, but dear friend, Secretary Javier Becerra to his first hearing as Secretary of the Department of Health and Human Services. Today, we are looking forward to discussing HHS's 2022 budget priorities, the department's ongoing response to the COVID-19 pandemic, as well as the Biden-Harris administration's overall response to the many longstanding problems and inequities in our healthcare system that this pandemic has underscored and exacerbated this past year. This is the Labor HHS Education Appropriations Subcommittee's first budget hearing on the Biden-Harris administration's 2022 budget request. In the coming weeks, we will also hold budget hearings with Secretary Miguel Cardona, Department of Education, on April 27th, Secretary Marty Walsh, Department of Labor, on April 28th, NIH Director Francis Collins, along with other NIH-IC directors in May, and CDC Director Rochelle Walensky, along with other CDC leaders in May as well. In addition, in May, the subcommittee will hold a hearing with public witnesses, as well as a hearing for House members to highlight their requests for 2022. The subcommittee will circulate further information in the coming weeks on hearings in May, once the dates and details have been confirmed. Mr. Secretary, as I'm sure you are very well aware, you are taking over leadership of one of the most important departments in the federal government. And it is an immensely critical time for this country as we recover from simultaneous public health and economic emergencies. This administration has made a strong start, and you certainly deserve credit for the many public health and economic recoveries that are currently taking shape. In responding to the COVID-19 pandemic, this administration increased daily vaccine doses to more than 3 million doses per day, which puts us well on the way to achieving the president's updated goal of 200 million doses in his first 100 days. Tuesday's news of the pause on the Janssen J&J vaccine may complicate our vaccination efforts, but we must have confidence in all of our vaccines as we combat COVID-19. I am grateful that this administration is committed to following the science. President Biden also took decisive action to respond to the economic crisis by proposing the American Rescue Plan, a $1.9 trillion relief plan to help American families. Most recently, the president proposed a bold plan to rebuild the nation's infrastructure, including the care economy, which forms the backbone of the overall economy. The president's proposal includes an additional $25 billion for child care facilities, $400 billion for home and community-based care, including resources and support for the millions of workers, mostly women of color, who provide these important care services for our loved ones. This new investment will build on the $50 billion that the Congress provided for children through the American Rescue Plan and the December Emergency Supplemental Appropriations Bill. And now the administration is once again taking the lead by submitting a fiscal year 2022 budget request for HHS with investments in health and human services that would improve the lives of millions of American families. The investments are vital. After a decade of sequestration and constraints and 2-year budget deals, we are finally beginning to address the needs of our nation's families, children, and underserved communities. We are finally beginning to address systematic shortfalls in our health and human services programs through the American Jobs Plan, the forthcoming American Families Plan, and annual discretionary appropriations. Many of the issues that have come all the more apparent in the wake of the pandemic, issues like maternal health crisis, childcare crisis, mental health crisis, and the gun violence crisis had already reached a breaking point even before the pandemic began, which is why I'm so pleased to see that the administration is doubling funding for gun violence prevention research, which is a priority that I fought for and succeeded in securing for the first time in 20 years in 2019. This budget proposal and this administration's response to the COVID-19 pandemic is certainly a great step in the right direction, but we are not running a mile here. We are running a marathon. Our public health infrastructure utterly collapsed under the weight of this pandemic. And while this budget addresses some of the failures that occurred in this system, there is still more work to be done. We need to consider how we are going to address the failures that cause 700 American women to die in childbirth each year. How are we going to address the failures that have led to 1 in 20 U.S. adults suffering from a serious mental illness? How are we going to address the failures that are pushing more women out of the workforce every day because they do not have access to quality, affordable childcare? This budget includes a record $8.7 billion for the CDC and $10.7 billion to address the opioid epidemic. It also includes $19.8 billion for HHS's child care and early education programs, an increase of $2.9 billion to expand access to quality, affordable child care, Head Start, and preschool. It includes $1.6 billion to address the mental health crisis, as well as $200 million for maternal health. Significant investments that are desperately needed to address critical programs, and I am confident this budget continues to move in the right direction. Combined with the American Jobs Plan and the American Families Plan, this budget will improve the lives of the American people. Mr. Secretary, it is time to be ambitious. We need a budget and a role for government that invests to give us a better future. Let me focus for a moment on women's health. Thank you for releasing proposed regulations this week to end the Title X gag rule. This action will ensure that people across the country have access to affordable reproductive health care and life-saving cancer screenings. More than 1,000 health centers left the Title X program due to the gag rule. In my state of Connecticut, New Haven is now the only place in the state where people can access Title X providers. We look forward to this rule being swiftly finalized so we can begin to repair the damage of the past 4 years. I hope you build on this progress by dropping the Hyde Amendment from your full budget. The time has come to reckon with the status quo and view this issue through the lens of racial equity. As I've said before, while the Labor HHS education bill has carried the Hyde Amendment every year since 1976, 2021 is the last year. The Hyde Amendment is a discriminatory policy, denies low-income women access to abortion, and that particularly hits low-income women of color. The inequities in our country's healthcare system that have been exposed by the COVID-19 pandemic all further expose the impact of the Hyde Amendment. Now is the time to empower all women to be able to make deeply personal life decisions without politicians inserting themselves into the doctor's office. I also want to raise the issue of the unaccompanied children currently in our care at the U.S.-Mexico border. I recognize Mr. Secretary, that you inherited a difficult and a challenging situation as a record number of children are fleeing traumatic circumstances and are seeking to be reunified with family in the United States. I am encouraged by your commitment to return this program to its human services mission of protecting vulnerable children. However, I will continue to push for a more transparent program. Oversight and monitoring of these facilities, especially with these large numbers of children, will be more important than ever. And I want to emphasize, as I have emphasized for many years, the need for HHS to comply with the Flores Agreement and to provide legal services, health and education services, and post-release services for these children. The Trump administration tried to turn HHS into an immigration enforcement agency. They separated children from their families. We need to do better. I am committed to working with you to ensure you have the resources to take care of these children, which includes housing them in state licensed shelters that meet all the standards of care, placing them with sponsors as quickly and safely as possible. Mr. Secretary, we have made a lot of progress in recent months, but there is still much more to do. At a time when the COVID-19 pandemic has only exposed the already serious failures in our public health system, it is time to be ambitious. It is time to meet the moment. It is time to do whatever it is that we can, not only to put our country back on track, but also to build the infrastructure for the future and chart a better and a more equitable course forward for all Americans. And I know the committee looks forward to working with you over the next year and beyond, and we look forward to today's discussion. With that, I would like to recognize the ranking member of the subcommittee, Congressman Cole, for any opening remarks.
Well, thank you very much, Madam Chair. And before I begin my scripted remarks, I want to welcome our friend and our former colleague to this position. And I couldn't be more pleased, other than, of course, had there been a Republican secretary. But that aside, the secretary and I, Madam Chair, had the good fortune of serving together with our late colleague Sam Johnson for many years on the Smithsonian board. And as everybody on this panel knows, on both sides of the aisle, he's a person of unquestioned ability, person of genuine integrity and decency. And while he certainly holds strong views, which I respect, some of which I agree with, some of which he knows I do not, when you serve together, you sort of know where everybody stands. But he's also got a practicing politician's fine sense of the possible. He was a great legislator when he was here. And so I could tell you, just from my experience on this committee, Mr. Secretary, whether it was under Democratic or Republican majorities, or whether it were Democratic or Republican secretaries, this committee's historically been very supportive of whoever the secretary of HHS is. We know, as the chairwoman indicated, how vast your responsibilities are and how important they are to the American people. And I don't know if we could do this time. Probably not, because I think your budget request is an ambitious budget request, which I applaud, quite frankly. But we've given secretaries of the last two administrations more money than they asked for, because we thought they had more problems maybe than they understood coming into these jobs. And again, as our chairwoman indicated, you're coming in at a challenging time. So I just want you to know up front, we recognize that. We recognize that we know there will be areas we differ. I'll mention some of those in my formal remarks. But I also know you're somebody we can work with and somebody that understands how we work. So I'm very delighted that the president made the decision to choose you, and why you made the decision to leave a wonderful position in California and come back here. You'll have to explain that to us over a drink sometime, but it is good to have you back. So with that, Mr. Secretary, I want to welcome you to your first hearing of our subcommittee. I look forward to our hearing with you today and hope that we can meet in person at the next one. The Department of Health and Human Services has broad responsibility covering almost every aspect of daily life. This is indeed a monumental responsibility that's been brought to light for everyone to see over the past year. I want to start by acknowledging the hard work and unwavering commitment of the employees of the Health and Human Services Department. Against nearly insurmountable odds, this agency has faced a global pandemic, and just over 1 year later, efforts of your agency have left our nation well on the way to having every willing adult vaccinated. Yet another truly remarkable achievement for the United States. Despite the many challenges of the past year, I was proud to see Congress come together 5 times to pass emergency supplemental appropriations to help us through the pandemic. Our work together enabled us to create funding packages that everyone could be proud of. I'm therefore disappointed that the majority's chosen thus far to abandon this bipartisan course in favor of the pursuit of a partisan budget proposal, complete with lengthy liberal wish lists replete with items totally unrelated to the pandemic or public health. The President pledged an administration of unity, but sadly it's begun with a legislative strategy of division. I certainly hope we can expect a return to an appropriations process that recognizes the role of bipartisanship, and I look forward to the release of the complete budget materials next month. Your agency oversees health care for our seniors and Native Americans and provides the foundation for core investments in public health and emergency preparedness. The National Institute of Health and provides the critical basic research leading to biomedical innovations, spawning new therapies, treatment, and medications for countless diseases. The social supports under your purview enables those seeking mental health or substance abuse treatment to have qualified evidence-based options available. The budget you put before us seeks to address numerous challenges: an opioid addiction epidemic, concerning levels of maternal mortality, a humanitarian crisis at the southern border, and a clear need to prepare for the next pandemic. However, I disagree with the approach taken in the administration's overall budget request. To put it simply, it spends far too much on domestic programs, far too little on defense. With China and Russia building up their militaries and becoming increasingly more aggressive, America cannot afford to stand still or cut back on defense spending. At a minimum, we need to see a 3 to 5% annual increase beyond the rate of inflation for defense spending over the next several years. That may require some adjustments in domestic spending requests. Looking at the domestic program, several of which are in this subcommittee, the budget proposal, like the most recent coronavirus relief package and infrastructure proposal, simply spends more than our nation can afford. Moreover, much of the spending is not necessary. Our economic recovery is well underway, and many of the proposed program increases, while well-intentioned, are not warranted on the scale requested. I do agree with the President that we need to invest more in the areas of public health and biomedical research. Indeed, in recent years, this subcommittee has spent more than either of the last two administrations requested in these areas. And I think the current pandemic has demonstrated the wisdom of that investment. To keep America safe and healthy, the United States needs to continue to increase funding for the National Institutes of Health, the Center for Disease Control and Prevention, and other related programs. And I note that you certainly made those proposals, Mr. Secretary, in your budget. We now have faced a pandemic in our lifetime. Let's use this lesson to leave future generations better prepared to address the next one. I firmly believe our investments in NIH over the past several years, made us better positioned to address the challenges of coronavirus. We cannot let that commitment to sustained increases waver. Like our national security, American leadership in biomedical research cannot be compromised. I was disappointed to see no mention of the Biomedical Advanced Research Development Authority, or BARDA, in the budget released last week, but I would expect perhaps to see that when we see a fuller budget. The success of Operation Warp Speed to develop, produce, and distribute multiple safe, highly effective vaccine candidates in less than a year is unprecedented in medical history. Now more than at any other time, we need to ensure BARDA continues its key role in countermeasure development. Our country needs to be ready to respond to any event to protect the health of the nation. In closing, I just want to mention one other important issue as it relates to this bill and your agency. For more than 4 decades, across multiple administrations and Congresses, led by both Democrats and Republicans, language has been included in the Labor, Health, and Human Services Appropriation Bill that restricts federal taxpayer funding for abortion under most circumstances. This provision reflects a time-tested balance of strongly held and differing perspectives on abortion in this country. Our bills have been able to advance year after year with bipartisan support with this balance in place. As such, I will strongly oppose any appropriations bill that seeks to weaken pro-life protections or eliminates Hyde policies. And I expect that under your leadership, HHS will continue to enforce those provisions of existing law. I look forward to our discussion today, and I thank you for coming before us. Again, it's a genuine pleasure to have you back, and I think a good choice by the President of the United States to persuade you to come and serve again. So welcome, and look forward to hearing your remarks.
Let me thank the ranking member and join you in welcoming the secretary. And many hours we spent at all kinds of meetings and leadership meetings, etc. And with you with a deliberative purpose in focusing on how, in fact, we could use the institution of the Congress to provide opportunity to people, to make sure that the people all over this nation get a better chance at a better life, and understanding that this is the place where it can get done, and that the role of the federal government is imperative, and especially at times of great crisis where the challenges are so overwhelming for the people of our country. So delighted that you are here. I could not be more pleased to looking forward to the great working relationship. And with that, Mr. Secretary, you know that your full written testimony will be entered into the record. You are now recognized for 5 minutes for your opening statement. Thank you.
Madam Chairwoman DeLauro, Ranking Member Cole, and to the members of the committee, it's a great pleasure, and I thank you for this opportunity to appear before you to discuss the President's fiscal year 2022 discretionary HHS budget. I understand the 5-minute rule. I know you know the subject matter of this hearing so well, so let me try to be brief. The COVID-19 pandemic demonstrated how health inequities and lack of federal funding leave communities vulnerable to crises. Now more than ever, we must ensure that HHS has the resources to achieve its mission and protect the health of our communities. The budget that the President has put forward places our agency, HHS, in the right place to achieve that outcome. For HHS, the budget proposes $131.7 billion in discretionary budget authority, $119.5 billion of which is for activities funded by this subcommittee. This $25 billion increase from fiscal year 2021 discretionary appropriations underscores this administration's commitment to prepare the nation for the next public health crisis, address racial disparities in healthcare, and invest in behavioral health, among other very important priorities. To start, the budget makes significant investments in our preparedness and response capabilities for the next public health crisis. It provides $905 million for the Strategic National Stockpile, which has served a critical role in the COVID-19 response. It invests an additional $1.6 billion in CDC, the largest CDC fiscal year budget increase in almost 2 decades. With these 2022 investments, CDC will address preparedness within the United States and strengthen global health security. Additionally, the President's budget provides funding increases to address violence in our communities. $489 million to support and protect domestic violence survivors, and $66 million for victims of human trafficking and survivors of torture. Gun violence, very much a public health issue and one that disproportionately impacts communities of color, is addressed by doubling both the CDC and the National Institute of Health funding levels for firearm violence prevention research. CDC will also receive $100 million to start a new community-based violence intervention initiative to implement evidence-based community violence interventions at the local level. To ensure that HHS is equitably serving all Americans, the discretionary request does a number of things. It invests over $200 million to reduce maternal mortality and morbidity, $150 million to support and protect domestic violence survivors, and $66 million for victims of human trafficking and survivors of torture. Gun violence, very much a public health issue and one that disproportionately impacts communities of color, is addressed by doubling both the CDC and the National Institute of Health funding levels for firearm violence prevention research. CDC will also receive $100 million to start a new community-based violence intervention initiative to implement evidence-based community violence interventions at the local level. To ensure that HHS is equitably serving all Americans, the discretionary request does a number of things. It invests over $200 million to reduce maternal mortality and morbidity, which excessively affects women of color. 2, it funds a range of rural healthcare programs and expands the pipeline of rural healthcare providers. It includes a $2.2 billion increase in advance appropriations for the Indian Health Services program within HHS. And 4, it increases funding for the HHS Office of Civil Rights by 24%. The budget also provides $340 million to the Title X Family Planning Program to improve access to vital reproductive and preventative health services and to advance gender equity. To help build the best possible future for our children, the budget provides $19.8 billion for the department's early care and education programs, including $11.9 billion for Head Start and $7.4 billion for the Child Care and Development Block Grant. The budget invests in improvements to the child welfare system, particularly to address its racial inequity. It provides $100 million to new competitive grants for states and localities to advance reforms that would reduce the overrepresentation of children and families of color and address the disparate experiences and outcomes for these families. The president's budget also takes action to address the epidemic of opioids and other substance abuse, investing $10.7 billion across HHS and increasing access to medications for opioid use disorder and expanding the behavioral health provider workforce, particularly in underserved areas. And in a historic investment, the budget provides $1.6 billion to the Community Mental Health Services Block Grant to respond to the systemic strain on our country's mental health care system. To support innovation and research, the budget increases funding for NIH by $9 billion, $6.5 billion of which will go to establish the Advanced Research Projects Agency for Health, ARPA-H, with an initial focus on cancer and other diseases such as diabetes and Alzheimer's. This major investment in federal research and development will speed transformational innovation in health research and speed application and implementation of health breakthroughs. Finally, given the magnitude of HHS's work and the taxpayer dollars used to fund it, it is critical that we ensure our funds are used appropriately. This discretionary request invests in program integrity, including efforts to combat fraud, waste, and abuse in Medicare, Medicaid, and private insurance. I want to thank this committee for inviting me to discuss the President's 2022 HHS budget, and I want to thank the staff at HHS for their hard work in fighting COVID-19 and for the health of their fellow Americans. To build back a prosperous America, we need a healthy America, and President Biden's discretionary request builds on that vision. Thank you.
Thank you very much, Mr. Secretary. I'm just very, very excited. Before I ask my first question, let me just mention something. The 2022 budget blueprint is strong funding for public health, biomedical research, childcare, early learning, mental health, maternal health, so many other areas. And we all look forward to seeing the details of the president's budget next month and that role for government that invests in a better future. There's one initiative that you mentioned that I'm looking forward to learning about is your proposal to allocate $6.5 billion to establish, if you will, ARPA-H. It appears to be a novel approach in supporting innovation to address key problems in health and medical research. Critical we strike a balance between this new approach and investments in basic research and fundamental discovery at the NIH. Once the full budget is released, this subcommittee will hold a hearing with the NIH, and we'll all have a series of questions about the ARPA-H program. So I'm going to hold those questions at the moment until we get to the NIH hearing. Let me turn to another issue. Mr. Secretary, your budget includes $4.3 billion for the Office of Refugee Resettlement. I believe this reflects the administration's intention to restore the nation's capacity to care for refugees, including the Unaccompanied Children program, which we know is stressed right now. You inherited a broken immigration system. It will take time to fix it. You also inherited a record number of children fleeing traumatic circumstances in Central America seeking refuge and asylum. And I know you're committed to doing what is right for these children. So a couple of questions here, Mr. Secretary. I've repeatedly pushed HHS to focus on placing children with sponsors as quickly and safely as possible. I commend you for rescinding the previous administration's harmful memorandum of agreement with DHS, so sponsors are no longer afraid that they will be deported if they sponsor these children. What else are you doing to safely expedite placement of these children with their families?
Madam Chair, thank you for the question, and thank you for your comments about the work we're doing on this issue. There's nothing more important than children. And at HHS, we take very seriously our responsibility to not only provide the right care and health, but to make sure that we pass this child on to a responsible sponsor, these migrant children that we are encountering at the border. And so what we're doing is, in that process of receiving that child from the Department of Homeland Security, the Customs and Border Patrol, and until the point we can find a responsible sponsor for that child, we are providing the care that's required. Typically, that means offering that child a licensed care facility to be in temporarily until we find that sponsor. And as that child is working through the immigration process to determine what will happen with regard to their status. While they are with us, we are hoping to provide them not only with the medical services that you would expect for any child, but also the care, which would include educational, recreational services. With the influx of minors at the border, those ancillary services of education and recreational service have become more taxing, more difficult, because the spaces that we're finding are fewer and fewer to be found. And so what we are trying to do is make sure we provide each and every child with every opportunity to receive not just the health and well-being care that we would expect for any child, but also the types of services that we would want to provide for any child as we pass them on to a sponsor. And we're working hard to move responsibly these children in the care of a vetted sponsor. We have to be careful. We want to make sure we put them in the hands of someone who will be responsible. And we also want to make sure that we get them there as quickly as possible.
Thank you, Mr. Secretary. Just a couple of other points in this area. I know we have set up emergency intake sites, and that is a new concept. And one of the issues is that because of the record number of children and the pandemic, that has reduced the capacity at state licensed shelters. Where we had 13,000 beds, that was immediately cut to half or less than half because of the precautions. So with the intake sites and the precautions we're taking there, standards of care, and you've spoken about that, let me just emphasize that I've said for many years the need for HHS to comply with the Flores Agreement so that the legal services, health, education services, post-release services for the children are in order. Let me ask this one other question here. We've got so many kids arriving at the same time. I'm concerned that children may have to wait for case managers while they're in the emergency intake sites. What is the plan to address the shortage of case managers at those intake sites and provider networks?
Well, Madam Chair, you to characterize this properly, there has been an influx. We are finding that we are placing some of these children temporarily in these emergency sites. They still offer those basic services that we would expect for any child. And we are trying to increase the number of intake workers that can help process these children so that we can get them placed. You can imagine it is a task to make sure that we get people who are doing the proper vetting, the background checks of the sponsors to get these kids placed. We do the medical check. We do everything we can to make sure that while they're in our care, their healthcare needs are addressed. And when we pass them on to a responsible vetted sponsor, that we are making sure that we understand that they will continue to get the care that they deserve. And so we have increased the number of intake workers that we have. We have actually called for volunteers throughout the federal government workforce to help us in this regard. We've been very fortunate. Several thousand federal workers have stepped to the plate, and we are pushing really hard with our contractors that we typically are able to use to do this work to increase their capacity as well. And so everyone is trying to team up, but again, it is difficult. As you mentioned, when we came in, the infrastructure, the architecture to do this work had in many ways been dismantled. And so not only was the agency not equipped to deal with the previous upticks in numbers of kids, but to see the increased number made it almost impossible.
Thank you, and I apologize to my colleagues for going over time. And I would finally say, I want to reiterate that we're willing to provide the necessary funding for this program. Like you, we want to ensure that the children have the services that they deserve. And I know that you are clear, as we are, that it is what we want to do is to move to state licensed facilities for children as quickly as we can, and to get them to a sponsor as quickly as we can. Thank you, and again, my apologies to my colleagues for running over the time. But Congressman Cole.
Madam Chair, you're the chair of this subcommittee and the full committee. I don't think you have to apologize to anybody when you take some time. Let me start. This is actually prompted, Mr. Secretary. It's a little bit off script, but some things you said in your testimony that I want to agree with and offer you some thoughts on. And that was your advocacy for increase for the Indian Health Service. And we don't actually have jurisdiction over that. That's one area of your department we do not. That's with our good friends on the Interior Subcommittee. But you're spot on in terms of the need and the importance of forward funding those programs to protect them, just like we do the Veterans Program. I would just commend to you and to this committee the challenge that they have over in the Natural Resources Department, Subcommittee, is simple. They just simply don't have enough money. This is the biggest, part of their budget, and yet they have the National Park System. They have the EPA. They have a huge range. And of course, this is the most important part of our healthcare system that's funded solely by discretionary dollars. And so we need to look towards some way to get at least some mandatory funding, perhaps similar to what we did a number of years ago to community health centers, which used to be funded only by discretionary dollars when they started, and we moved to a combination. That's been renewed every time it's come up for renewal. So there's a jurisdictional problem here, which is a problem we have in Congress of not having this all in a single area. There's just a lot more discretionary dollars in this pot at Labor Aids than there is at Interior. And then there's this idea that we're going to fund a major health program with solely appropriated dollars, which we don't do for anybody else. And the only reason why it is that way that I can figure out is just it was the first health program the federal government funded, and it existed before Medicare, Medicaid, and the mandatory programs. And we sort of forgot about it and put it over to the side. I'd love to have the opportunity on another occasion to talk to you and address this and find out ways we could work together. But I really appreciate the proposals that you put forward here. Let me move quickly now to BARDA and ask you some things that you may be I may be asking for an advanced peek of your full budget. But as I mentioned in my opening remarks, I think that agency has done an important job. We also had the infectious disease response fund, something that the chairwoman and I worked on together to both establish, and she's really been fulsome in funding that. I'm just curious about what your plans are in that regard.
Congressman Cole, first on Indian Health Services, I'll be making a call because I know your level of interest, your expertise on this subject matter. Indian country is fully aware of your expertise and your support. And we will be discussing with Indian country this issue of mandatory funding. And I appreciate your words because it will take a bipartisan effort to make sure we move in the right direction to finally fulfill our trust responsibilities, our treaty responsibilities to Indian country. So I very much look forward to working with you on that. On BARDA, I think we're on the same path. We recognize how important BARDA is to knowing how to get to the next level and to avoid these types of pandemics, doing the research and the development that's necessary. And so I will tell you that I'll look forward to sitting with you to discuss that as well, because BARDA is an agency which is pretty small compared to others, but it does a mighty lift every time it does something right. So look forward to working with you on that.
Well, very good. I will welcome that call. And again, I think we can make those efforts bipartisan. Let me ask you something on the Weldon clause. As you know, that's basically means we don't force providers to provide services that are against their faith. This is, I know, a difficult question. It's a tricky question, but I'm just curious, will you commit to the subcommittee, particularly not to reduce the conscience division that we have in the Office of Civil Rights? That's actually where we protect people's ability to not be forced to render services that they don't believe in.
Congressman, as you stated yourself, some of these issues, while we agree on many paths to take on some of these issues, sometimes there are some disagreements. On this issue, where I can tell you that we can agree is that my responsibility is to follow the law, and you all will decide what that law will look like, whether it's through the appropriations measures or through legislation that you all pass. I can guarantee you that at HHS, we will follow the law. Where it comes to measures and where we will go, where we have some discretion, what I can tell you is we will take input from all parties as we move forward, trying to make sure that we move forward at the executive or administrative level to make sure that we are responding to all concerns. But I can guarantee you this, Congressman, we will follow the law.
Well, I know you will. I draw considerable comfort from that, and I know this is an area that we will disagree with. I mean, the chairwoman and I disagree on this area, so I really want to work to keep those disagreements in bounds where we can still have a bipartisan outcome and a bipartisan budget, and that's the danger here. And everybody around this table on whatever side of the issue knows that it is. I look forward to our continuing discussion on that. But again, welcome. It's really good to have you in the position. And I know there's going to be a lot of areas we can cooperate. I take great pleasure in looking at your NIH budget, great pleasure in looking at your CDC budget. In those areas, we agree, at least I agree very much with what you're trying to accomplish there. And I think you've taken some of the hard lessons of the last year and responded to them very well. And replenishment of strategic stockpiles, another one where I think you're on the right track. So with that, Madam Chair, yield back and look forward to the rest of the hearing.
Thank you. And with that, let me recognize Congresswoman Watson Coleman. And I want to say a thank you to Congresswoman Roybal Allard for allowing Ms. Watson Coleman to go before her since the Congresswoman has a hearing, I believe it is at 11. So Congresswoman Watson Coleman, you're recognized.
Thank you very much, Madam Chairwoman, and thank you to my colleague for yielding to me first. First of all, congratulations, Mr. Secretary. It is good to see you here. Yours is such an important agency when it comes to the health and well-being from our infants to our retiring adults from the womb to the tomb, and I can't think of a better person that can head that agency. One of the important issues for me, well, actually all of the issues that have been discussed already are important to me, but through the lens of equity and the disparities regarding minorities, particularly Black and Brown communities and women, I am very interested in knowing how we're going to accomplish the narrative that is throughout your budget, as well as with the President's presentations to us when it comes to ensuring that everyone is treated with dignity and respect, and the resources that are needed to ensure that are allocated appropriately. So I want to talk a little bit about maternal and infant mortality and morbidity, because that is a huge issue, and there's a demonstrated disparity that negatively impacts Black women in particular. My First Lady, Tammy Murphy, under her leadership and her husband's leadership, has really been engaging actively in this whole issue and has assembled experts to deal with the issue and to recommend things like dealing with bias, implicit bias, ensuring there are more providers, etc. I want to invite you, either virtually or in person, to have a conversation with her, with me, of course, and with her team, so that you might know what we're doing and you might look at it as some best practices, because I think that this is important. For me, all of the good intentions in the world are great, but I'm really focusing on accountabilities and what is actually going to impact the well-being of the people that we're targeting. So with regard to that, I wanted to just share that with you. The whole issue of mental health. I'm telling you, this budget, it is very encouraging for me. It signals help is here. Help is more than just a concept. It is here. And I want to make sure that you have an understanding of what's on my mind. First of all, I did an emergency task force on Black youth suicide and mental health, because we saw that there was an uptick in that community. And a report resulted in that and some recommendations. And I need you to take a look at that, and I hopefully be able to support us in those recommendations, but both in resources and in practice. The NIH has been talking to us as we've been talking to them, because we're concerned that there's not been enough research in the area that impacts minorities in this situation. There's not been enough stakeholders discussions. There's not been enough people reviewing grants, and there's not been enough allocations of grant money to those issues that have been identified by people who are expert in the areas and have community relationships. So I'd like very much to know if you had any discussions with NIH, if you know of anything that they're doing right now with regard to making sure that there is greater conversation among the various stakeholders, and if we're going to be able to move forward in ensuring greater diversity in NIH, in the conversations that take place, and in the kind of review of grants and areas of grants. If you might want to comment.
Congressman Watson-Coleman, first, it's a pleasure to be here with you, take your questions, and know, again, your spirit hasn't changed. And so absolutely, I look forward to working with you on all these things. I've had conversations with the various agencies within HHS. I've made it very clear, equity will permeate everything we do. And when it comes to NIH, whether it's the data, whether it's the studies and surveys, and whether it's the participation rates, we want to make sure that it is done in a way that incorporates everyone. We don't want to leave anyone out. And so I welcome your input, your participation, look forward to hearing some of the thoughts that you have. We are putting more than $200 million into this issue of maternal mortality, because we know, and it's especially high for Black women and Alaska Native women as well. And so we're going to make sure that what we do is put resources behind what we say. And look forward to
just say in closing that the Office of Civil Rights is so vitally important. And that's where we will look for the accountability. So I do look forward to subsequent conversations with you specifically, Mr. Secretary, regarding how are we going to hold the offices within your department accountable in ensuring that the civil rights and the pursuit of equity is actually happening. And I thank you. I yield back, and Madam Chair and to the ranking member, thank you very much for allowing me to ask questions out of turn.
Thank you very much. And let me recognize now Congressman Harris.
Thank you very much, Madam Chair, and welcome to the Secretary. First off, I do want to echo what the ranking member said about I'm glad to hear that you're willing to enforce the law as written, including the church amendments, the Weldon Amendment, ones that are, I think, a very important conscience protection for our healthcare. And as a healthcare provider myself, something that I think is very important to enforce those current laws. Let me just move on to surprise billing. One concern that's raised, we've passed the No Surprises Act, but there's concern among some of the stakeholders that stakeholder input may be bypassed by issuing an interim final rule instead of a proposed rule, giving them time to comment. So I'd like to know if you could commit that you will give ample opportunities for stakeholders to participate in the rulemaking process by assuring that there'll be a proposed rule with a 60-day comment period on this.
Congressman Harris, coming from a background as the Attorney General, where it was always important to take input whenever we would do rulemaking or whenever we would take any action, whether in court or otherwise, I can guarantee you that at HHS, before we take any action, we will take the comments necessary, hear from all the stakeholders to make sure that we're doing is based on the facts, the science, and the law. And I can guarantee you, sir, that you will find that we will have gone through a robust process to get there.
Thank you very much. With regards to health security and the SNS, I'm glad to see that the appropriations, the suggested budget is at $905 million for SNS, which is, and I want to thank the chair for supporting my amendment 2 years ago to bring it to that level. But there's an interesting statement in the budget proposal that implies that that it's not just going to be simply stockpiling expired material, but that's not what the SNS ever did. It never was just about simply restocking expired material. So I take it that we're going to continue to look not only to restock what needs to be restocked among expired material, but then, of course, to expand into areas that we think are forward-looking in terms of what we need to do according to the FEMC plans that have been put forward. Is that right?
Congressman, you're right. We're going to learn from our experiences with COVID and all the rest to move forward and be prepared.
Okay. Yeah. And obviously renewing some of the stockpile is part of that, but I'm sure that was just inarticulately written in the budget plan. Now, I'm just going to spend the last 2 minutes talking about NIH and a concern I have, and I want to know what your vision is for ARPA-H, because if it's a vision of merely doing advanced translational research, then NCATS should have done that. I mean, we already have the ability within NIH to do that, but that would move NIH further away from basic research, which I think is the main role of NIH, because we know that other corporate entities, other businesses, they may do some of the non-basic research, but they're not going to do basic research. So is ARPA-H, what's your vision for what ARPA-H is going to be?
Congressman, we're trying to move beyond just the basic research to be able to have transformational results. And we've seen, the clearest example is these vaccines for COVID. We've seen how quickly the private sector working with the government sector can move. And so we want to be able to continue that basic research that has made America the place to go to when it comes to these discoveries. But we want to try to trigger transformation faster, because that's what we need to do, is be prepared. So what we have with ARPA-H is an opportunity to combine the best of what we already have, that basic research when no one else can compare to, and also then make it click. And so while ARPA-H is still fully in development and the concept is there, what we think we can do is help make things click a lot faster by putting some additional money into that research and development that lets us get something from an idea to actually a practice.
Well, Mr. Secretary, that's exactly my point. That's called translational science. We already have a center in NIH for that. And pointing specifically to vaccines, what made it possible with the mRNA vaccines is that we actually invested in the basic science research at NIH for over a decade. So again, if it's just a new translational center, it's just going to do, my feeling is it would just duplicate what we already have. So I would urge that basic science be an important part of an ARPA effort at NIH, and I yield back, Madam Chair.
I thank the gentleman, and with that, let me recognize Congresswoman Lucille Roybal Allard.
Mr. Secretary, it is so good to see you. Like other colleagues, I've had the privilege of serving with you, not only in the House, but also in the California State Legislature. And I want to join with comments made by others that we could not be better served than to have you as our Secretary of HHS. I'd like to begin by thanking you and President Biden for including a request for $200 million to fund a maternal mortality initiative, because so much more needs to be done to address the maternal mortality crises in this country, in which the hardest group of folks are Black, Latino, American Indian, and Alaskan Native communities. It also includes, as you know, mothers and babies also experience different outcomes based on where they live. There was a plan put together in recognition of the disparities in maternal health last December by the Surgeon General, and he issued a call to action to improve maternal health, and the Department of HHS rolled out the Healthy Women, Healthy Pregnancies, and Healthy Futures Action Plan. And the plan outlines 3 specific targets to improve the nation's maternal health outcomes by 2025. And they are to reduce the maternal mortality rate by 50%, reduce low-risk cesarean deliveries by 25%, and to achieve blood pressure control in 80% of women of reproductive age with hypertension. Is it your intention as Secretary of HHS to continue this work that was underway in the past administration?
Congresswoman Roybal Allard, thank you for the question. That's an easy one, of course. And you know so very well from knowing me for so many years that we think it's a priority. I know you think it's a priority, but my wife, if I were to go home, who is a maternal fetal medicine specialist, would not let me in the house if I didn't consider these priorities. So we are going to work these hard because it is important that not only are women allowed to live a healthy life after they've given birth, but that their children are allowed to grow up and be healthy as well.
Okay. I have another hopefully easy question here, Mr. Secretary. Since the initial passage in 2008 of My Newborn Screening Saves Lives Act, it has helped ensure high quality diagnosis and life-saving follow-up interventions for over 12,000 newborns diagnosed each year with genetic endocrine conditions. And as you know, the Newborn Screening Act codified the Advisory Committee on Hereditary Disorders in Newborns and Children to help address the vast discrepancies between the number and quality of state screening tests. Because of this committee's work, today 49 states and the District of Columbia screen for at least 31 of the 35 currently recommended core conditions. In September 2019, the reauthorization of the newborn screening law expired. And it is my hope that it will be reauthorized this Congress. Unfortunately, the previous administration suspended the activities of the advisory committee, which is preventing it from completing its work. As Secretary, you have the authority, which is reinforced in the 2014 newborn screening reauthorization, to deem the advisory committee a secretarial advisory committee and to continue its charter. Given the essential role the advisory committee plays in our nation's newborn screening system, will you use this authority? And when will you extend the term of the committee until reauthorization occurs?
Congresswoman, I fully understand the value of that type of work that has to be done. And what I can tell you is that while a decision hasn't been made, I can get back to you as quickly as possible on the course of action that we will take administratively. But without a doubt, I think what we want to do is move forward, not step backwards.
Okay, and I look forward to working with you on this because this committee, advisory committee, is absolutely essential in doing the work of protecting newborn babies.
I appreciate and agree.
Congressman Fleischman. Let me ask Congresswoman Roybal Allard, have you concluded?
I have, yes.
Okay,
thank you.
Congressman Fleischman.
Thank you, Madam Chair. Mr. Secretary, congratulations, sir, on your appointment and confirmation. I wish you every success in your endeavors. And again, thank you for your service in the great People's House prior to this. I had hoped to actually speak with you personally before this, and I've got a constituent issue, Major, that I would ask you to call me perhaps after this, but I wanted to delve in on some very important issues. There's a crisis at the border, sir, that includes an unprecedented number of unaccompanied minors. Once these children are on U.S. soil, we have a responsibility, sir, I think, to treat them with compassion regardless of their legal status. The administration is relocating these children to ORR facilities across the United States, one of which is actually located in my hometown of Chattanooga, Tennessee. and it's predicted that HHS will need an additional 3,400 beds by September to prevent children from waiting in overcrowded Border Patrol stations. My first question, sir, is given the surge of unaccompanied minors and the lack of bed space due to COVID restrictions, what kind of funding levels do you anticipate are necessary in order to operate and maintain HHS detention facilities for the ORR program, sir?
Congressman, thank you for the question. Very important subject. Before I get to that, let me just make sure we connect at some point soon with regard to the issue that you mentioned. I apologize that we haven't had an opportunity to connect earlier.
Yes, sir.
On the issue of the unaccompanied migrant children, we are expanding our capacities as quickly as we safely can. And that's the operative word, is safely. We're not going to jeopardize any child. We're not going to do things in a way that add to the trauma the child has already experienced. And it is a challenge because it's unlike adults and unlike any circumstance we've seen before. We have to do this right. We're going to make sure that at HHS, when we have a responsibility, we do it as we're supposed to under the law. And our role is health and human services. And that's what we're going to do, is provide health and human services to these children while they're temporarily in our possession. And we have continued to expand our bed capacity far beyond the capacity that existed even 3 months ago, far beyond the capacity that ever existed under any other administration. But we still have challenges. And the team is working really hard. The fact that several thousand of these kids are in our care and they continue to be provided the kind of care that we would want to see for any child is a testament to the hard work being performed by the men and women at the Department of Health and Human Services. But we will try to keep you all informed because you are so essential. The type of resources we'll need far beyond what has been provided in the past. Our request is, I believe it was $3.4 billion for this coming fiscal year. We believe that if we're able to receive your support, the funding support, that we should be able to address this again, as the law requires us to do it at HHS.
Yes, sir. Thank you for your response. What steps has the administration taken to ensure transparency throughout the HHS contracting process, sir?
We will be reporting obviously to Congress on that activity. We are trying to make sure that all of our work is done with licensed facility operators. We are trying to make sure that when we operate a site that's more of an emergency site, that we are working with our local partners to make sure that the contracts are within the framework of what we've done in the past. I think what you'll find is that you will have eyes into this. We have to respect, obviously, the privacy of children. They are minors, so access to the facilities where they are is different than from access to for adults. But what we will make sure is that we operate in a very transparent manner. The most important thing we can do is make sure that you're apprised and that the American people are apprised of what we're doing. Because at the end of the day, what we want is for everyone to see it. At HHS, we believe in our mission on health and human services for these children.
Thank you, sir. And consistent with that, I would ask that as we had situations like that in Chattanooga, that the administration be very transparent and let us know what's going on in our districts, whether we're in Chattanooga or anywhere in the United States. I know my time is running short, Mr. Secretary, and I just wanted to let you know that I plan to submit several questions for the record addressing CMS designations for EMS transport services, which is affecting a lot of our rural areas, the 190-day cap on inpatient psychiatric services, which I think needs to be extended, COVID relief for assisted living facilities, and some other areas. But again, I thank you for your service. I wish you every success, and I look forward to hearing from you, sir.
Look forward to calling you soon.
Yes, sir.
Congresswoman Lee.
Thank you very much. Good morning. First of all, Mr. Secretary, I have to associate myself with all of the remarks that have been made, and congratulations to you. First of all, I think Congresswoman Roosevelt, Allen, and myself, we've had the privilege to call you Assemblyman. We've had the privilege to call you Mr. Chair, Mr. Attorney General, and now Mr. Secretary. And so it's awesome. Good to see you. And thank you for your leadership. I have several questions, so I'll be trying to summarize these questions very quickly because this department which you're heading is so critical to the survival and thrive, not only survival, but our young people especially thriving in this country. And so thank you so much for taking this on. Couple of things. I hope, and we sent a letter to reestablish the White House Office on National AIDS Policy. You know, I've been working on HIV and AIDS forever. And so I'm glad to see that the budget includes $670 million for funding the end of the HIV epidemic. And so I just want to be sure that the strategies that you employ in collaboration with other agencies will help us reach that goal of eradicating HIV and AIDS by 2030. And so as it relates to HIV and hepatitis, in all populations, all geographic areas, you know that it disproportionately impacts people of color and people especially living in the South. So I want to know how you're going to prioritize efforts to improve health outcomes and to help us achieve that goal. Secondly, with regard to public health, and I want to follow up with Congresswoman Bonnie Watson Coleman's line of questioning as it relates to disparities. You know, I have legislation with Congresswoman Presley and Senator Warren to declare racism as a public health issue. CDC now has embarked upon including many of the provisions of our bill in their declaration that racism is a public health issue. So as you look at disparities and equity, wanted to find out, do you all have a lens of how we also dismantle those structures and those systems that are institutionalized that really present racist outcomes that show as it relates to the disparities that we have to address through, in many ways, through your agency. So it's not only equity, but it's about disrupting those institutions that are the barriers to equity. And then I had the privilege to go to Carrizo Springs and to El Paso with the delegation, and I wanted to follow up on the questions with regard to the children and specifically with regard to those who are in the Customs and Border Patrol. In El Paso, of course, and everywhere we have been, we're told, naturally, we know that our Border Patrol employees are there to patrol the border, not to take care of children. And so they were asking us for more help, more case managers, so they can be freed up to do their job. So I know your overall plans. Are we going to make sure that in the Customs and Border Patrol departments and agencies that we hopefully transition in case managers to help relieve the burden? And if we have a second round, I'll ask you my other questions. So glad to see you.
Congressman, always a joy to be able to chat with you and work with you on all the subjects that you mentioned. I'm definitely looking forward to that and your guidance on how we move on some of these issues. And I think you sense that we actually have a real chance to move on some of those first issues you discussed, because we're putting real money behind some of these efforts. So I'm looking forward to working with you on that. Let me spend a moment on Carrizo Springs and the unaccompanied migrant children. We have to remember that our mission is separate and apart and different from the Department of Homeland Security's mission. And in fact, we make sure that it's clear. Our role is to care for these kids. DHS and Customs Border Patrol is in the mission and in the business of trying to protect the border. And so within 72 hours, they are supposed to hand to us any child that they have so that that child gets the care that by law is required. That's become a challenge because of the numbers that have come through. I believe CBP and Department of Homeland Security have done a remarkably good job of making sure that they are handing us a child who's ready for our care. But it has to be quicker, and that's where these case managers become important. But we have to make sure that it's clear that there are different roles that we play. And as you know from the laws, we have to make sure that we don't cross outside of our own lane. And so that's what makes it difficult at the time. But we're trying to break down those bureaucratic barriers to make sure that our principal interest is the well-being of that child. And I want to thank Department of Homeland Security and the Customs and Border Patrol officers and personnel for working with us to try to make that as smooth a transition as possible. It's still a work in progress, but again, our interest is the care of these kids.
Okay, second round, I'll go back to the other questions. Thank you very much. Thank you, Madam Chair.
Thank you. Congresswoman Herrera Butler.
Thank you. Thank you very much, Madam Chair. So I wanted to follow up on some of the unaccompanied minor questions. What role, if any, do you, Mr. Secretary, have in facilitating migrant travel, including expenses, once individuals or families are released into the interior of this country?
Congresswoman Herrera Butler, great to see you again. Important question. We have authority to provide for transportation resources to make sure that these children are united. Once we've identified a responsible sponsor, to make sure that the reuniting occurs as quickly as possible. So what we try to do is reserve our resources for the actual care, but we don't want to continue to see a child languish in our care if there's a responsible sponsor. So sometimes it's actually more efficient and cost effective to try to help make that transportation work so that the child is united as quickly as possible.
On that piece, are you aware that the FBI vetting of sponsors for these kids has ceased in many cases as a result of the overwhelming caseload? Which I know your concern is these kids' care, as is mine. That's why I'm asking this. And I've heard reports of kids being told, say you have family in New Jersey, they get sent to New Jersey, and then a trafficker there says you get to work off the cost of your fees. I mean, this makes me sick. So to hear that the FBI vetting is not actually always taking place means we could be helping traffic children. Am I way off here?
You've raised a really important, legitimate concern, but this is one of the I'm glad you mentioned this and asked the question, because this is one of the issues that takes the time in trying to transfer this child into responsible sponsor hands. We have to make sure that that sponsor truly is responsible. There have been cases in the past, none that I'm aware of in the time that I've been secretary, but there have been cases in the past where a child has ended up in the hands of someone who's either trafficked them for sex or for labor. And so what takes a while, and it's unfortunate because we'd like to place these kids in responsible hands as quickly as possible. We have to verify, and we will do everything we can. We are working with all the agencies that help us do those background checks and verification. We will not let go of a child unless we have confirmation for our purposes under the law that we can let go of this child to a responsible sponsor.
Can I ask, does HHS confirm whether these kiddos are COVID negative before they're put on planes to travel across the country?
All these children are tested, so we know what their status is on COVID-19. Now, remember, sometimes it can take up to 2 weeks before a diagnosis a test can tell you whether or not it's accurate. But what we have always done is made sure that we test these children as quickly as we can once they are in our care.
Thank you for that. Obviously, there are more questions there, but I wanted to transition a little bit and say thank you for your investment and leadership on both the maternal mortality issue, which I know my colleague Lucille Roybal-Allard mentioned, but also on the opioids and the mental health piece. Obviously, the pandemic's had a large impact on mental health, and it's increased the use of drugs and alcohol, especially opioids. And in my home district, the rate of drug overdose deaths in Cowlitz County has increased by 43% in the first half of 2020. And for all of Washington State, there was a 38% increase in drug overdose deaths in the first half of this year, or of last year. So synthetic opioids, fentanyl, played a very significant role in that statewide increase. And I just wanted to see how HHS is going to target, because you specifically focus on supporting populations with unique needs, people in rural areas, underserved. I wanted to see how you plan to target that.
Thank you for the question. I think we all agree that we have to really jump on this issue of the opioid addiction and actually substance misuse and the addiction that comes from it, because we've seen how COVID has stressed everyone and actually made these circumstances even more difficult. And so we're making a major investment in addressing opioid and other substance use issues. And what I can tell you is this: we want to make sure we're targeting. I know from my work as a state AG that we're on the verge of reaching major settlement with a number of these opioid manufacturers to get monies for abatement purposes. We want to make sure at HHS we're working with the state and our local partners to make sure that we combine our monies with their monies to make it most effective. We're going to try to work with them the way they see fit to try to use their resources. But what we're going to do is make sure we're concentrating on getting the kind of treatment that helps someone move off of these very addictive drugs.
Thank you for that, Mr. Secretary. Madam Chair, I yield back.
Thank you. Congressman Pocan.
Thank you, Madam Chair. Hello, Mr. Secretary. It's good to hear that. I remember the day you got the offer from the governor to become Attorney General. I was sad to see you leave, but very glad you're back in federal government in a much more significant role. So thank you. First of all, I just want to say you guys did an amazing job investing in people in this budget, the best CDC budget in 20 years, investing in HIV and opioids, refugee resettlement, NIH research, on and on and on. Thank you for doing that. I have 4 things, and because I know you know how it goes in 5 minutes, I'm going to ask my 4 questions and let you answer them as you know best. So first of all, fetal tissue research ban. The last administration put a ban in place. This is something that's very important in my district where we do a lot of research to the University of Wisconsin-Madison. I'd be curious about the removal of the federal restrictions imposed by the last administration on fetal tissue research. Second, also the last administration had discrimination. They allowed for discrimination with agencies contracting. I'd love to know if there's any plans for a notification of non-enforcement and any new rulemaking to provide for non-discrimination in HHS programs. Third area, I got 4 of these. I'm going to go as fast as I can, Mr. Secretary. An issue around opioid and preventing opioid abuse. The former HHS a while back had proposed putting a plant that's helped an awful lot of people get off of opioids called Kratom as a Schedule 1. In the last administration, actually, the Assistant Secretary did the right thing. Admiral Jurar sent a letter to the DA rescinding their view that it should be a Schedule 1 drug, because recently in appropriations, we got money for research, and the research is coming through really well. It is helping people, not just with opioids, but we have a very close family friend who uses it for another autoimmune disease. Would love to know that we're going to continue to do research and not try to push this into Schedule 1. Love to know if you can continue that commitment. And then finally, just curious on the Office of Refugee Resettlement, specifically on refugees coming in. I hear from a number of agencies that have had people that they were going to help relocate in my district. And I know the president was going to have an executive order to help improve the numbers coming in. And because that has not been signed yet, I'm curious what the status on that, because I have one agency very aggressively asking me in my district about this issue, and I'd love to be able to get back to them. Again, I'm so glad you're Secretary, Mr. Secretary Becerra, and I look forward to working with you during this administration.
Congressman Pocan, it's great to see you again. And as usual, I'm not going to have enough time to get to everything that you're championing. So let me try to do this. We'll try to make sure we respond to where I don't get to it. But let me, on the fetal tissue research ban, we'll be making an announcement. NIH will be making an announcement, I believe, tomorrow. And so you want to keep your ears open for that. But we believe that we have to do the research that it takes to make sure that we're incorporating innovation and getting all of those types of treatments and therapies out there to the American people. On the whole issue of non-discrimination, as you know, Congressman, from the work we did together, I'm all about making sure we treat everyone fairly. And anytime that we see signs of discrimination, we want to take action. And so we want to make sure that we are enforcing non-discrimination laws. And I can commit to you that as Secretary of HHS, I'm going to be on that, on that for sure. Opioids, I'll have to get back to you on where we are on that issue. Let me put it this way. When you've got a president who's willing to commit over $10 billion in his fiscal budget to start tackling opioids, you know he's serious. And so we're not going to do anything that undermines our ability to really go after the scourge of opioids and what gets people caught up in this addiction. ORR, if you could frame again what the question was, I've already forgotten it.
Just the president was going to do an executive order so we could have a larger number of folks, refugees coming in. We had people in my district agencies ready, and then people sell all their goods ready to come here, and now we're in a holding area.
Well, briefly, I can tell you that the plan is to increase the number of refugees we accept in this country to a number we haven't seen in a number of years. And all of that will depend on what you all do to help us have the resources to be able to accommodate some of these folks who are fleeing from death, persecution, and violence. And so we look forward to working with you on that one.
Great. You did it. You're impressive, Mr. Secretary. I yield back, Madam Chair.
Congressman Molinar. Congressman Molinar?
Can't hear you.
Okay, that should be good. Well, good morning, Secretary Becerra, and congratulations and welcome back in your new role. And I just wanted to highlight something. Recently, along with my colleagues in the Michigan delegation, we sent a bipartisan letter to President Biden requesting a surge in vaccine allocation to our state that is estimated to prevent 10,000 hospitalizations and save 1,200 lives. I believe you may have also received a request from Governor Whitmer on this. And so far as we can tell, that has not been granted. We do appreciate your efforts to send more therapeutics and boots on the ground. But I'm wondering if you would consider a modification in the strategy and grant this vaccine request given Michigan's situation right now.
Congressman Molinar, thank you for the question. And let me give you a sense, given the work that the administration has done, and I'm even impressed at what President Biden has accomplished when it comes to the vaccine. When you can vaccinate more than 3 million Americans as we go forward, I mean, most of us were wondering how many people we could get vaccinated in a day, but had someone said to you we could get 3 million Americans vaccinated in one day, I wouldn't have believed it. We hit 4 million, I think, over the weekend, and so it's impressive. The president has also made sure we have the supply we need to get shots in arms to 300 million Americans, essentially the adult population. By I think now pretty much every state is offering vaccination administration to every adult, not just those over a particular age. And so we're moving in that direction. How we can address those states or those regions where there is a disturbing increase is something we can take a look at. We can work with you. What we have to make sure is that we don't get off the plan of making sure the vaccine is available everywhere where it's needed. As you can imagine, if we start to focus only in certain particular regions, we'll start to have that disparate treatment of other regions. And so what we want to do is work with everyone to make them available. We work with the states and local governments to make sure that they handle some of that administration. We do have some sites that are federally operated to make sure we're reaching everyone, but we're always open to conversation about how to do this best and fast and making sure we incorporate all Americans. And so what I can say to you is we'd be willing to chat with you more about this to make sure that as we move forward, every American will have access to that vaccine.
Well, thank you, and we look forward to working with you on this. I was concerned. I think that CDC had come out and said maybe Michigan should shut down again, and I just don't think that was a real viable option. But I do think increasing vaccines, increasing the therapeutics would be helpful. But appreciate your willingness to work with us on this. Also, just my district is predominantly rural, and one of the things during this COVID pandemic is we've seen the importance of telemedicine and the value in that. And I'm wondering if, as Secretary, if you'll be able to continue to allow flexibility and incorporation of telemedicine so that we can continue to grow that. Obviously, rural broadband is a huge issue in some of the rural areas, but I think some of the rules that you're going to be involved in advancing telemedicine could be really critical in helping our rural communities.
Congressman, because you've touched on a really important point, I hope that you will be in touch on that matter, because what we have learned from, especially from COVID, is that telehealth has been a godsend. It has helped so many Americans have access to the kind of care that for them is difficult under normal circumstances, nearly impossible under COVID. And so we're going to try to apply all those good lessons moving forward beyond the pandemic on how we deal with telemedicine. And so you probably have some good thoughts. You probably have a lot of constituents who are stakeholders who have a lot of good ideas. We hope that you'll reach out and provide some of that, because as we move forward, we want to make sure that we remove every barrier that we can from Americans accessing the kind of quality healthcare that they're entitled to.
Well, thank you. And just in closing, thank you again for being here. I would also like to add my voice to those who have expressed concern about repealing the Hyde Amendment. I do think this is something where, when I consider, how children are affected by abortion and including children of color, I think this is very much the wrong direction, and hoping that we can work towards a bipartisan effort on this. Thank you, Madam Chair.
Thank you. Congresswoman Clark.
Oh, thank you, Madam Chair. And it is such a delight to have you, Secretary Becerra, and I associate myself with all the comments about how excited we are for your leadership and the incredible work that we can do together on behalf of the American people. And on a personal level, you were the first member of Congress after I won my special election to invite me to Washington. So I am delighted to be here for your first appropriations hearing. And just really welcome back. And we are so excited to have you. One of the issues that is so pressing for American people, and especially for American women, is the childcare crisis. We know that 1 out of 4 women have left the workforce since the pandemic, specifically because they are not able to find care for their children. So as we look at a study from HHS in 2016 that said if we triple the Child Care Development Block Grant from 16 numbers, which would be $8 billion, we could bring 652,000 women back into the workforce. Can you elaborate on how you see this connection, especially for low-income women, and how you view childcare as economic infrastructure?
Congresswoman Clark, first, forgive me if I'm smiling so much, but yeah, I feel like I'm attending a family reunion, and
we do too.
It's nice to see so many familiar faces, and I know how hard you all work. And even as I think Congressman Cole had mentioned, sometimes we're not going to agree, but there is a relationship you develop with colleagues, and I so much appreciate the chance to be back and to work with you, and even on those tough issues where we don't necessarily agree from the beginning. On the issue of childcare, the president's making a major investment in childcare, including that block grant for childcare, more than $7 billion. He understands not only how important it is to care for kids. Look at the work he's done addressing migrant children at the border. Clearly, the work we're doing for kids here in America, he is on it. And what I will tell you is this: we're going to make sure that money is well used. We're going to work with you to partner to make sure that we're doing everything we can to deal with the care that a child needs. Because at the end of the day, you hit on it. If we don't do this, the economic vitality of our country will never reach its pinnacle, because so many women will be left with the inability to really just blossom within their careers. So not just for the kids, but for all those talented Americans who would be out there productively working, we got to make sure childcare is taken care of.
Thank you. And you mentioned the incredible investment that the administration has already helped us make through the America Rescue Plan. Can you tell us a little bit about how that distribution is going of that funding? Are there areas where we can be helpful in helping making sure that funding gets to childcare providers efficiently? And are you concerned about the need for more discretionary CCDBG funding to offset a potential cliff after states exhaust that stabilization funding?
Yeah, those cliff issues are always difficult, and that's where we're going to really need to partner with you to make sure we don't find families reaching that cliff. So I look forward to working with Congress to make sure that we continue to have some predictability, the certainty that families need on how they can budget forward and protect their children and be out there working. In terms of how the resources are being distributed, once again, we'll need your help to make sure that we're doing this right. We're going to do a lot of oversight and accountability, but based whether some of this money will go out based on formulas that determine where the kids are and how it goes out. Others will be based on grant funding where applications are put in by different stakeholders who apply to provide services. But at the end of the day, and this is where I put on for a second my hat as a former attorney general, we expect accountability. We're going to bird dog this because it is so essential that we provide the oversight to make sure that those dollars reach the child. And so we'll look forward to working with you in a partnership because I know you want to make sure that the monies you will allocate to us are well spent. And we all want to make sure that whether it's the child or the parent, that we have allowed them to be as prosperous and productive as possible.
Thank you so much. And I yield back.
Thank you. Congressman Klein.
Thank you, Madam Chair. Thank you, Mr. Secretary, for appearing today. Wanted to circle back to the crisis at the border and in particular regarding the unaccompanied children program under HHS supervision. You talked about accountability, and I think that this administration is abdicating its responsibility when it comes to not only making sure that our border is secure, but caring adequately for those who are coming across. Because of the rhetoric on immigration policies, we have seen spikes in illegal border crossings, record numbers coming as a direct result of the changes in policies of this administration. So we have high numbers of children being placed in the unaccompanied children program, a startling number of whom have tested positive for COVID-19 after being transferred out of border stations, sparking concerns over cramped and overcrowded facilities that may allow the virus to spread. You have several facilities that are being operated, some of which are being, are in nonprofits, other temporary accommodations. But for example, from March 1st to March 30th, there was a total of 647 COVID-19 cases in 40 out of 50 Texas HHSC Office of Refugee Resettlement Operations. These are self-reported positive COVID-19 cases in migrant children in care. At the Carrizo Springs, Texas facility for migrant children, 10 to 11% of kids have tested positive for COVID-19. There were 766 unaccompanied migrant minors stationed at the site, which has 952 beds at the time. I think what we're seeing is a failure by this administration and a failure by your agency to adequately care for these children and to prevent them from contracting COVID-19 and passing it on once they are released into the interior of this country. So I'd like to hear from you what this administration is planning to do to ensure that people coming across this border, whether legally or illegally, do not have the coronavirus, and they are stopped at the border before they are entering this country illegally if they do, to prevent Americans from contracting this deadly virus.
Congressman Klein, thank you for the question and the spirit in which you asked the question. I appreciate that. I think I've heard from everyone the same thing. We all have the interests of these children at heart, and regardless of what their ultimate outcome is, whether they end up being sent back home or if they are able to qualify to stay here, the concern that we have at HHS is that while they're in our care, we do it right, we do it under the law, and we provide that health and human service that they expect. So let me respond to some of the points that you make, because it is important that we make sure when it comes to COVID, that whether it's these kids or certainly anyone within the American family, that we're doing all to protect them. First, the reason you can cite those different numbers is because HHS is being transparent. We're not trying to hide anything. We want folks to know what we are doing, how we're doing it, and we want you to see it because it's important. We're not interested in hiding anything about the care for these kids. It's important for us that people see it, because when you hide things, it's because you're not doing it by law, and we are going to do everything by law. When it comes to COVID testing, as I mentioned previously, we test every one of these children. We do not release any child that has been tested. Certainly, we do not release a child who's COVID positive out into the community. We also provide care for kids who are COVID positive. We make sure that we don't have them commingling with kids who have tested negative. Which again, of course, is an additional responsibility and burden for us because it means less space. By the way, I should add here, we are able to place fewer kids in licensed facilities today because of COVID. We've had to provide for the adequate spacing for children. And so the type of facilities that would have been available before to deal with the unaccompanied migrant children, no longer available to those capacities. We're having to deal with fewer licensed beds, but more kids. And so you can see how it's become a challenge, but we're doing it, and we're doing it safely, protecting these kids and protecting the American public. And at the end of the day, our job is to protect and to offer care and to do it according to the law.
Thank you, Mr. Secretary. I only have a couple of seconds left. I just wanted to shift over to the issue of fetal tissue research. I hope you're going to continue the Trump administration policy, and that's going to be your announcement tomorrow. And then just one last question, Madam Chair, if I might. Do you consider the 1973 Roe versus Wade decision to be settled law?
Congressman, I believe that Roe v. Wade has given women the opportunity to exercise their rights under the Constitution and our laws to provide for their health. And I hope that we continue to see that Roe v. Wade was a compromise in how we can make sure that women, their rights are not violated when it comes to how they get their health care.
But you'd agree that it's settled law?
I have no question that Roe v. Wade is an important legal precedent that we must abide by and make sure that women have access to the health care that they need and that they get to make the decisions on that health care.
The reason I ask is because the Hyde Amendment was passed only 3 years later. So that should be considered settled law as well. Thank you, Madam Chair.
Congresswoman Frankel.
Hello. Okay, let me see if I see myself. Okay, there we go. Hello, Mr. Secretary. It's so nice to see you. Congratulations. I'd like to just start with a couple of comments and then get to my questions. Just following up on Representative Clark's discussion on daycare. The daycare industry is in crisis, and even before the pandemic, costs were too high for parents and the pay was too low for the workers. Now with this pandemic, getting parents back to work, especially the women of this country, the women workers have been hit very hard. Just keeping in mind that parents cannot get back to work if they don't have safe, nurturing places for their children. And so it's so important that we consider childcare not only as advancing our children, but advancing jobs. As to the Hyde Amendment, to me, the Hyde Amendment is the ultimate form of discrimination against low-income women. I won't say anything more about that other than that. And as to Title 10, thank you to the Biden administration for the new rule reversing Trump's, what I call a suffocating gag rule that puts so many women at risk at not getting many over 1.5 million couldn't even get basic primary care, and it putting women at risk for abortions in unsafe conditions, death related to pregnancy, and increased STDs, not even being able to get a mammogram. Now to my questions. The Affordable Care Act's birth control mandate ensures that women will have coverage for at least one of each type of birth control method approved by the FDA by requiring employer-sponsored plans to cover birth control without a copay. In May of 2017, President Trump issued an executive order which set the stage for expanding the use of religion to discriminate against people seeking reproductive care. And this allowed employers to deny birth control coverage to their employees by claiming, in some instances, vague religious or moral objections to certain methods of birth control. And I agree with those, and there's, I would say, the majority of people in this country, that the type of birth control that a woman uses should be her decision, not her employer's. Question: will the Obama-era rules that allow exceptions only for the houses of worship but still ensures women at these that these employees could access contraception through their insurance company or third-party administration be restored? And can you explain the reasoning?
Congresswoman Franco, great to be here with you, and thank you for always having that spirit and fire. But you're not going to like my answer here, because I am recused from responding to questions on this subject because of my previous role as the Attorney General in California, where I was involved in litigation on this very subject. So while I have a team at HHS who is working on these matters, I have to keep myself distanced from them because I had a role that was very obvious where I was as the Attorney General for California on this matter.
Well,
Forgive me.
At least I thank you for being on the correct side of this issue, and I just wish your folks the best in reversing this order. So let me get on to another subject quickly. Every day in the United States, 10,000 people turn 65, and the number of older adults are going to more than double over the next several decades. Wow, that's a lot. I read an article that said 70% of 65-year-olds will need some long-term support before they die, but they really have not done any planning. They think their kids are going to take care of them or their grandchildren, which who knows if that's true, but if it is, it's going to take lots of people out of the workplace. So question is, I see there's a big request for home and community-based services to help older adults and individuals. Could you just tell us how this funding is going to be used and the Biden administration concept?
Absolutely. For those of us who are baby boomers, we see the value in having our government believe that we have to continue that or have that continuity of care. We are going to try to make sure that this president and this administration are making major investments to try to make sure that caregivers of some of our family members are able to stay where they are and make a living as well. And so whether it's providing $550 million for home and community-based services, which is, by the way, an increase of about $158 million over the previous fiscal year, we are making sure that we make those types of opportunities available to families. We want to make sure that older Americans continue to receive access to the nutrition that they've come to rely on when it's hard for them to afford it. And so we make additional investments in some of those nutrition programs for our seniors. And we continue to make every effort to try to make sure that everyone who is under the age of 65 and doesn't yet qualify for Medicare can qualify to have access to health care, whether it's through the Affordable Care Act exchanges or perhaps through some of the proposals that the president is gearing up that would help a lot of our older Americans who are not yet Medicare eligible have access to the kind of care that they need. I could go into more details, but you and I know the importance of Meals on Wheels for so many seniors, but it's also making sure that those caregivers that some of our older Americans rely on are actually able to do the work and afford to keep that as a living.
Thank you. Thank you. I yield back, Madam Chair.
Thank you. Congresswoman Bustos.
Mr. Secretary, yes.
Yeah, Congresswoman
I'm
Bustos.
on.
Yeah.
Thank you, Madam Chair. And Mr. Secretary, it is so great to see you. I will echo the kind words of my colleagues and just how excited we are that you're serving as in the Biden cabinet. You're going to do remarkably well. We know that. Mr. Secretary, I'd like to cover the Center for Disease Control Social Determinants of Health program. And I also want to throw out my thanks to Chairwoman DeLauro and also to Ranking Member Cole. With them, we have been able to stand up a $3 million program that's based on legislation that we wrote out of my office called the Social Determinants Accelerator Act. And so the program provides grants to state and local governments to develop plans to combat social determinants of health, like food deserts that we see in a congressional district like mine, long drive times to doctors that you see in very rural congressional districts, and they're negatively impacting health outcomes for people. I cannot tell you the level of excitement that I feel when President Biden announces a $153 million request for the program this fiscal year. Mr. Secretary, a few questions. First of all, as part of last year's funding bill, we directed Health and Human Services to create a social determinants interagency council that would be made up of representatives from Health and Human Services, education, labor, and many others to help communities applying for these grants. If you could, do you know the status of the council as it stands right now?
Congresswoman, great to be with you. And believe it or not, I don't. And I'm going to admit that I don't, but I will check with my team because, as I said to everyone beforehand, we're going to be on this one. And so I will get back to you quickly on that.
Okay. We will wait to hear back from you. And it makes me feel good that you're committed to making sure that that gets up and running, and if it hasn't already. But I don't know the status either, and because it's a bill that we wrote out of our office, very, very interested in knowing that.
Congresswoman, you had me at hello on that one.
Okay. All right. Look forward to talking with you more about it. So when will local communities, if you know the answer to this, if you know when local communities would be able to apply for the $3 million worth of social determinants grants, I can tell you this. We have heard from many of our communities in the congressional district that I serve in Central and Western and Northern Illinois about their interest in being able to apply for grants. Anything you can maybe let us know about that?
Yeah, and you are really getting granular on me. And as much as I did a lot of homework to prepare, I can't give you the answer on that, Congressman, but I can do this. I can make sure my team is taking notes and we get back to you as quickly as we can, because although we've got a budget, we're talking over $130 billion, $3 million for a lot of communities is going to make a big difference. So we'll get back to you on that.
Absolutely. Okay, so let's then shift to kind of a bigger picture part of social determinants. With President Biden's announcement of $153 million that he's requesting in his initial budget, how that would has the possibilities of assisting so many communities around the country. I'm guessing you have been involved in those discussions with President Biden. Can you talk a little bit about how you envision that working? What are the next steps? What would you like to see happen with this $153 million? You probably even know how the $153 million number came to be, but if you can talk a little bit about that from a bigger picture perspective.
And thank you for that. Let me give you a sense of how I hope to approach this. One, can't use a cookie cutter. What works in one community may not work in another. Two, you got to look at every corner, because we often miss those corners where communities are trapped, and if you miss them, then you've really not dealt with the whole issue of healthcare and making sure that you're dealing with social determinants of health. So make sure you turn over every stone. Three, we're not going to know how to best do this from Washington, D.C. And so that means partnering with the local communities to ask them, looking to the people who are respected and are the leaders in the community to help guide us on how we're going to do this work, because they're going to know where we're lapsing, we're not doing as well as we should when it comes to addressing the social and healthcare needs of communities that have been left behind. And so working closely with partners at the local level, turning to respected leaders, making sure we don't assume that the communities in that corner of the region were already addressed, and making sure that we're doing this in a way that we partner with everyone who understand this, who are the experts, we should be able to come up with a good way to address this. And at the end of the day, as I said earlier to some other questions, to me, accountability is so important. I want to show that we delivered on our dollars, and I want to make sure that if someone gets that money, that they delivered on that dollar as well. Taxpayers deserve that.
Well, again, Mr. Secretary, thank you so much for your commitment to this. I look very much forward to working with you. And I know you've gotten many invitations already, but would love for you to come to our congressional district and see some of the struggles that so many families and individuals are going through as it pertains to access to health care and just some of the struggles. But thank you. Wonderful to see you. Madam Chair, I yield back.
Thank you. Congressman Harder.
Thank you, Madam Chair, and thank you, Secretary Becerra, for coming before the committee. Given your deep knowledge of the state of California, I'm really looking forward to working with you to make sure that all the federal dollars we're talking about today come to areas of the state like my district in the Central Valley that are sometimes overlooked by federal budgets like this one. Specifically, I think that COVID has exposed some of the cracks that have existed for a long time in our healthcare system. One of those is the provider shortage, especially in rural areas like the Central Valley. When we had 0% ICU bed capacity for many months in many parts of our state, it wasn't because we didn't have the physical bed capacity, it's because we didn't have the doctors, the nurses, the healthcare workers that were necessary to get people the care that they desperately needed. The American Rescue Plan that we passed a couple weeks ago had funding for 100,000 new public health workers. And I was hoping that you could give us an update on the hiring of those workers, the implementation timeline for putting those folks to work, and how you see that really supercharging some of the capacity needs that we have across our country.
Congressman Harder, great to see you on this committee and doing some great work. When the president sought to get those 100,000 public health workers out there, it was principally to make sure that on COVID, we were on it, and we wouldn't have a shortage of personnel to keep us from getting Americans to the access to the testing and certainly now to the vaccines. And so principally right now, the effort is to make sure that no community doesn't get the service they need when it comes to dealing with the pandemic because they have a shortage of personnel. And so how those 100,000 public health workers will be distributed will be based on the needs in those various communities. And we can discuss that with you as well. I know your district so well, as you know, and you're absolutely right. And there are other aspects to the American Rescue Plan that are going to help places like your district, because whether it's the increased number of residency slots that are going to be available now to provide those newest doctors out there providing services, healthcare services through the training they're getting, or in the case of your area, having UC Merced, which is a new university that's going to be able to provide access to a lot of different services to a lot of folks, and maybe in the future have a medical school and those kinds of things. Those are the kinds of investments that we can make that I think at the federal level we can partner with you and the local leaders there to make sure that we're servicing and not forgetting folks who live in the Central Valley of California.
Absolutely. On the healthcare workers specifically, there was a note from the administration that there was a desire to make at least some of these workers a permanent improvement on the capacity of our public health system across the country. I didn't see a lot on that in the sort of blueprint of the budget. Is that something that you anticipate fleshing out? And can you give us any detail on how you would anticipate funding those public health workers going forward?
No question that many of these workers could easily become permanent and help many of our communities. I know a lot of areas in rural America would be desperate to have some of these folks become permanent workers in their areas. We're quite honestly, we'll have to partner with you because we'd have to figure out a way to make sure that working with our local leaders, we can make those positions permanent. And that takes money, and that takes Congress, and that takes the support and partnership of our leaders, state and local leaders to make that happen.
Absolutely. One of the other challenges is that moving beyond just the public health worker, we focused a lot on nurses and doctors, as you know, and mentioned. The Central Valley is half the doctors per capita that the rest of the country has. I've been working a long time on trying to expand the public service loan forgiveness program to include California and Texas. It doesn't today. I know this is primarily a Department of Education issue, but it really does affect your agency and making sure that we have healthcare available to everybody across the country. Would love your support to try to include California and Texas at long last into this program, which would lead to 10,000 physicians coming just to our state in areas of need. But more broadly, is there anything else that we could be doing to accelerate some of the programs necessary to get physicians and nurses in areas like the Valley?
Congressman, if that's an open invitation for some suggestions, I think the most important thing is to make sure the local stakeholders don't wait until they hear that there's going to be money to let us know. Plant the seed now, because I don't think most people believe that the American Rescue Plan would have been out there and been able to do so much good so quickly. And so plant the seed now with HHS. Let us know where there's a need, and we'll try to work with those local communities to make sure that when we're ready to launch, we don't forget places like the Central Valley.
Absolutely. Looking forward to working with you, and thanks so much for your leadership. Back to you, Madam Chair.
Thank you. Congresswoman Lawrence.
Thank you so much. I join my colleagues in being so excited to see your leadership. I just fell. I have a couple questions for you. I am so appreciative of the skinny budget and all that President Biden has done. But President Biden has stated that we have a gun violence epidemic in this country and we must address it. We're going through this very troubling time and dealing with violence from police, seeing so often that it's mental health that's needed, but the only response we have is a police officer pulling up and discharging a weapon. Can you please let me know how the department will use increased funding to promote partnerships between mental health providers and law enforcement? We know that there are so many people who are imprisoned right now who, instead of needing to be incarcerated, need mental health. And your department is going to be very, very important in that role. And the other issue I would like for you to address, everyone has talked to you about the need for mental health. And as our children are being confronted with such a different reality that generations of children have never experienced, the number of suicide rates and everything has increased. So we must infuse an education of mental health component. And it's not optional, in my view, at this time. And I feel that you can be a leader in this and also provide it. My last point is, everyone has talked to you about mental health. What are we doing to incentivize children or young people going into college to get degreed in mental health? Everywhere I go, they tell me there's a shortage of mental health professionals. And you can't just throw up a shingle and provide mental health. It must be through education. So those are my three issues, and I just want to tell you how excited I am for you to be in that role, and I look forward to working with you. Are you there, Mr. Secretary?
There we go.
There we go. Okay.
How about now? I was just saying, Congressman, great to see you again, and thank you for the fight that you've always made on some of these issues. Let me try to respond quickly to them. Gun violence. We all know, so what is it? About 40,000 Americans die from firearm injuries as a result of our lack of action on this every year. It's the third leading cause of death for Americans aged 10 to 24, the third leading cause of death. And so President Biden has made it very clear, this is a public health crisis, and we have to address it. That's why he's made sure that we're in our budget providing $100 million to the Center for Disease Control and Prevention to start a new community-based violence intervention initiative that will work at the local level with stakeholders who want to deal with this gun violence crisis. We know that we need to do more with regard to domestic and gender-based violence. That's why he's making a major investment of close to $500 million within our administration for children and families to support and protect domestic violence survivors. We know that 1 in 4 women, and by the way, about 1 in 10 men have experienced contact sexual violence, physical violence, or stalking at some point. And so we're making real commitments, because it's one thing to talk it, it's another thing to walk it. And I think the president made very clear we want to try to address these things. When it comes to mental health, Congresswoman, as you know, this is one of those areas where none of us have ever fully come through to match our words. And I think President Biden has made a major commitment here to start to fund the services that we need to deal with mental health conditions that a lot of Americans are suffering from, especially during this time of pandemic. And so I think you're going to find that this budget is more than just numbers. It's a statement on values by the president of the United States.
Do you have any plan on how we're going to get more mental health professionals so that we can meet the need that we know is going unaddressed right now?
Know that a lot of those current mental health professionals would say, pay us a more commensurate salary so that you can attract professionals into that work. And unfortunately, because we've lagged behind in treating mental health the way we treat physical and other customary health issues, we haven't seen the kind of investment that we'd like. And so hopefully we can make that happen.
Thank you.
Thank you. We are coming to noon, Mr. Secretary, and I want to alert my colleagues that we really don't have time. We would all love to have a second round, but which we will be unable to do. But I just want to make a comment before I yield to the ranking member for any comments or question or closing before I close. But what an incredible discussion today, and that is testament to your commitment, your expertise, and your approach to dealing with difficult issues, the difficult issues we are facing today. I'll also just say that we thank you for your clarity and also for your candor. If you can't answer a question, you can't. If you disagree on something, or maybe potentially disagreeing, is to lay that out. But it really has been really so forthright, Mr. Secretary, and the way in which hearings which should go forth in this effort. And I also want to say at the same time to my colleagues on both sides of the aisle, I thank you for your the expertise that you bring and the questions that you bring for what has been just an extraordinary exchange, and done in a manner that befits the really very significant challenges that we face today, and that we need to be wherever we're coming from, or wherever our own disposition or interests, that we can come together. I found in a book that I wrote 4 years ago, when this country was formulating a social safety net, that it was crafted by legislators on both sides of the aisle, Democrats and Republicans, who understood the nature of the problems that we face today, that we faced then, and the challenges. And whatever their political disposition, they came together and they forged agreement and legislation that has accrued to the benefit of the American people. And I know it's your hope, it's our hope, that that's the same kind of ability that we can bring to the challenges that we all face today. And with that, let me just yield to my ranking member, Congressman Cole, for any comments or any further questions, and to close, and then I will close.
Thank you very much, Madam Chair. And I want to associate myself with your remarks about the nature of the hearing we've had today. And I think that reflects, Mr. Secretary, partly a great deal of confidence in you on both sides of the aisle. We know who you are. We've had the opportunity to work with you. When we've differed respectfully, but you're a person that has a gift for finding common ground without surrendering his principles, and I think that will serve you well. I hope in listening to the committee, I love the Appropriations Committee. I mean, I really tell people, I don't care if you're on the left or the right, the appropriators are deal makers in the end. That's not true of all of our members on other committees. They may be on the left or right, but they're what I like to call shirts and skins committee. You figure out pretty quickly where's everybody at, and the teams don't change and the lines don't change. That's not necessarily true here. There's a great deal in your budget where we will find common ground. I applaud again the emphasis on NIH, CDC, certainly the discussion we had about, which not something we'll deal with on this subcommittee, at the Indian Health Service and the forward funding proposals. There's a lot there. And there's other areas where we've shown we can work together in other parts of your department, everything from early childhood and first generation college students. A lot of this is under your purview, and again, it's a broad swath of responsibility. Some under yours, some not. But again, there's a lot here that we can find common ground on. And I appreciate the respectful manner in which we talked about Hyde. But I will be very clear there, and I don't do this in any kind of way to try and start a fight or whatever. But I do remember on one occasion, on not the Hyde Amendment itself, it was actually another one of these life issues, and my friend, the chairman, and I were involved in negotiation with our friends in the Senate. And one of our good friends in the Senate, I had a speaker at the time that was very much interested in this, a particular issue of this. I'm going to leave them all unnamed. But my friend on the other side of the aisle in the other chamber said, Tom, you can have a deal or you can have a fight, but you can't have both. I thought that was a pretty wise saying. I actually took that back to the then speaker, reported it, and I said, what do you want? He thought for a minute. He said, I think I want a deal. And that's where we arrived. 6 years in a row. I'm very proud of this, by the way. 4 years I was chairman, and when we got to the end of the day after the negotiations, my good friend, the then ranking member, now chairman of this subcommittee and the full committee, voted for final passage because we worked toward a deal. In the 2 years that she chaired this subcommittee, we ended up in the same place. I voted for final passage as well. And I would very much like to get to the point where I could do that again. And so the commitment I'll make to you is I'll work toward that end. But again, just as I understand there are positions that put my friends in awkward circumstances that they can't violate their principles, the same thing's true on our side. So I just say that to be mindful of it going forward. But I think you saw in your first session before this committee, it's a committee that wants to work together. First thing I figured out when I was fortunate enough to chairman and figured out the areas it wanted. NIH was one of them. Early childhood was another one of them. First generation college students over on the education side was another one. Where were the areas they wanted? And I hope you noticed, well, I certainly did. I thought all the questions by all our members were thoughtful and respectful and asked in a good spirit. I think they're trying to figure out how they can work with you. I do think the range of responsibilities you have are exceptional. I sometimes think we ought to rename your title ought to be Secretary for Biodefense, because that's a big part of your deal. I look on what we do here as every bit as important in defending the American people as what's done over on the Department of Defense. And I sit on that subcommittee as well. And I think this pandemic has illustrated that like nothing else. Losing 500,000 plus people in a year is an indication of how critical the work that this agency does, this subcommittee does, and your agency does for the American people. And so I take the responsibility like that. I don't see this as just a dollars and cents game. But I see these as programs that really protect the American people and are absolutely indispensable. And I also see them as programs that improve the quality and address some of the disparities that you and other members of this you addressed in your remarks, and other committee members on this subcommittee have dealt with for many, many years and worked hard. And we know there's a lot left to do. So I just end by welcoming you to your new position of responsibility, letting you know that the door is always open, that we want to work with you. We want you to be very, very successful in what you're doing. And I'm quite certain that this subcommittee will try to find common ground with you and try to help you achieve some of the goals you've laid out that I think all of us in a bipartisan sense would agree are for the good of the country and in many cases for the good of humanity. Because again, what some of the agencies you do, obviously they impact our country first and foremost, but this committee has the power, the subcommittee has the power to do good all over the world. I mean, some of the work that you will be doing at the CDC and NIH and cooperating with people around the world in terms of dealing with the pandemic are important for all of us and enrich the lives of all humanity. So I think you're well chosen, well positioned, and we look forward to working with you. For that, Madam Chair, I yield back.
Thank you. And I think we share our sentiments on the secretary and his knowledge and his goodwill, and I look forward to working with you as we go forward. Mr. Secretary, let me just make 2 points and then I will close. Wanted to ask you for a commitment. I have serious concerns about the Strategic National Stockpile. I think we need to review the mission, the scale, the management, the transparency of this very, very, very important federal asset. And I'd like to have your commitment that you will task your team with beginning a rethinking of the Strategic National Stockpile so that we can move forward and the American people can continue to have confidence in this asset. I say that because I asked over and over and over again in the last several years for an accounting, because we appropriated serious dollars, believing that it really is a national asset, without any response, without knowing what was there, or so forth and so on. So I would very much love to have your commitment on that effort. And the other point is with regard to the unaccompanied children, and I know that you're working in this direction with regard to a long-term plan, and we want to move as quickly as we can to help these children. And the administration, I know, is developing that long-term strategy. And given your comments today that children who ensure that those children in our custody are housed in state licensed shelters, and they're treated with respect, and they're placed as quickly and safely as possible with sponsors. And I know that's that those are the values that you bring to this issue. And if I might just say that I'm really pleased with the 2022 budget for HHS. It includes strong funding increases for public health, biomedical research, childcare, early learning, mental health, maternal health, so many other areas. And for me, we're finally moving toward a budget and a role for government that invests to give us a better future. We're moving toward a budget and a role for government that elevates our education, our healthcare institutions, so that ordinary citizens have the increasing prospect for success. And it tilts the playing field so that normal citizens have a better and a better shot at life, and that parents understand that their children can get a better shot at the American dream. And above all, it says that poverty is unacceptable. It's unacceptable, and that we have this institution and this committee, this subcommittee, has the capacity to abolish it. Mr. Secretary, thank you for your testimony today. Thank you for who you are, and thank you for your public service. And with that, I'm supposed to bang a gavel, which I do not have, so I'll bang the phone. This hearing is adjourned. Thank you.